Hello, everyone. On behalf of Dr. Patricia Silla and myself, I'd like to welcome you to the session, Back to School Basics, Relearning the Hand-Sewn Anastomotic Technique in Colon and Rectal Surgery. I'm sorry we're not in person, so here's a picture to make you feel like we are. These are my disclosures. So why not? Why don't we currently perform more hand-sewn anastomoses? Well, it's simple. Staplers have certainly made bowel anastomoses easier and faster to create. Particularly down in the deep pelvis, staplers are much easier to perform a secure anastomosis where visualization and access are challenging. And in fact, the majority of all bowel anastomoses currently are performed with staplers. Many of us do not currently perform any hand-sewn anastomoses, and even if forced to, we might not be comfortable doing this. But we remember last year where there were massive recalls of surgical staplers from the two major companies who supply the majority of all staplers, and this overlapped. And there were times where you were doing a case and you were asking for your stapler at a certain point, ready to create an anastomosis, and being told the stapler is just not available. And this was largely the impetus for designing this session. But there are other times where it might be more advantageous or necessary to create a hand-sewn anastomosis, particularly if you do a low anastomosis deep in the pelvis and there's a large air leak that you can't adequately visualize or correct. Perhaps there's a stapler misfire and the staple lines completely open up, or there's bleeding. Sometimes you might be doing a very difficult case. Maybe it's a Crohn's procedure and you just have the inability to mobilize the bowel safely enough to get access to the healthy bowel to create an anastomosis. So there are many times where a hand-sewn anastomosis is still advantageous and or necessary for the surgeries that we do on a regular basis. We have an expert panel here to take us back to school in relearning when and how to perform a hand-sewn anastomosis. I'd like to take this time to plug the SAGES Colorectal Surgery Master's Program collaboration, and if there are any of you in the audience who are members of SAGES but not currently a member of this group, I strongly urge you to do so. It's an invaluable resource. Thank you very much.